Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health Systems. This morning, Brad White, our PH, and I are broadcasting from our administrative offices, and our special guest is Dr. Ira Richterman, a board-certified orthopedic surgeon. Doctor, good morning and welcome to the show.
Good morning, guys. Thanks for having me.
Dr. Richterman is with OrthoUnited, a newly formed joint practice between the former Spectrum Orthopedics and Omni Orthopedics. This is our second in a series of discussions with OrthoUnited. Dr. Richterman is board-certified orthopedic surgeon specializing in hand and wrist surgery with a specialization in tendon and nerve procedures and complex reconstruction. We'd like to remind our listeners that our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So again, good morning, Dr. Richterman. Tell us a little bit about yourself.
Hi, good morning. Thanks again for having me. I am a board-certified orthopedic surgeon. All I practice in today is hand surgery. I've been performing hand surgery here in Canton, Ohio since 1997. I'm originally a New Jersey boy that somehow ended up in the Midwest, and I haven't looked back. I've been with Omni Orthopedics originally since coming to town, and as of January 1st, we're really happy to have our collaborative with our colleagues in town, Spectrum Orthopedics, and as a result, we've become OrthoUnited. We're 35 physicians strong, taking care of our local community, and looking forward to hopefully many decades to continue in this field of medicine.
So, which OrthoUnited locations do you practice at? And tell us about the Oasis Surgical Center.
Sure. I practice at 3 office locations. I am actually in the office every day of the week. So I always try to tell patients, you know, if your little one has fallen off the monkey bars, or unfortunately, if you cut your finger in the kitchen, I'm available every day of the week. Some of the days I'm at my main campus office, which is on Belpar, and 2 days a week I'm out in our satellites. Wednesday afternoons I'm in Dover, and Friday afternoons, this afternoon, after our radio program, I'm heading out to Alliance. So I see patients in all 3 locations.
Okay.
Oasis Surgery Center. Go ahead. I'm sorry.
Tell us a little bit about the most common hand conditions you see on a regular basis.
So you have to look at hand injuries and hand problems in kind of 2 different facets. You have more of an emergent basis of what we see, whether it's the lacerations or fractures, crush injuries, broken bones. You know, nowadays, once football gets started, you know, unfortunately, the kids are getting their fingers all tangled up in various parts of the equipment in the field. And so that's one aspect of the practice. Majority of us is the elective side of the practice, which are things such as carpal tunnel syndrome and trigger fingers and different ganglion cysts or small tumors of the hand. Unfortunately, for many of us, we lived in an era where we weren't really understanding of the negative effects of the sun had on our skin. And unfortunately, skin cancer is a real animal on the back of the hands just because of sun exposure. So hand really allows us to have a tremendous variety in the world of orthopedics. And so I sometimes mention my patients, I'm really a construction worker. Sometimes I'm a carpenter fixing fractures. Sometimes I'm a plumber putting arteries back together. Sometimes I'm an electrician putting nerves back together. But by and large, I mean, people don't understand the hand is actually the #1 injured part of the body. And so if you actually look at ER visits across our nation, and we're looking at trauma, the frequency of which hand injuries occur is by far the #1 leading reason.
All right, so let's talk about hand injuries. So, you know, we've all been weekend warriors and been working in the yard, or turning a wrench on your Jeep maybe, and you smash something or pinch something. At what point does it become, okay, I take a couple Motrin and see how it is tomorrow, versus, all right, do I need to go see the doctor?
No, Brad, that's a great question. I mean, from a practical perspective, when patients hurt themselves or they have a pain, in their own mind, of course, it's always an emergency, right? My hand hurts. Oh my gosh, I need to see somebody today. And I think when you're talking about any aspect of healthcare, you have to ask yourself, my hand hurts. What should I do? And I think first you have to ask yourself, okay, is this emergency? I just cut myself. I'm bleeding, or I fell down. My little kid fell down, and his arm just looks crooked. I mean, those are things that we need to address a little bit more now than 3 weeks from now. And so that's the first question that patients need to ask. I always say, if you're not sure, please call and come in. And that's why myself, as I'm a big believer in the fact that I'm in an office setting every afternoon of every day of the week. So, if you're not sure and you need to come in because I'm not sure if this is an infection that's really brewing or this is a cut that I need to address, and that's the first question: emergency versus non-emergency. I think the other question you have to ask yourself is, if I've had this problem for 2 hours or 2 months. And that's also, really an important issue. If you've had hand pain or you've had something that's been bothering you for 2 months, do you need to necessarily call your primary care doc, or do you need to run to an emergency room right now? No, of course not. And I think the better part of planning there is to pick up the phone, call the offices, call OrthoUnited, and get an appointment with either somebody, an orthopedic surgeon that you've seen before, or one of our pain management specialists, or ask the secretaries, hey, who should I see for this particular injury? And oftentimes when patients ask those questions, we base it on various aspects. If Mrs. Smith calls in and says, hey, I want to see Dr. Richterman, well, of course, they're going to try to get Mrs. Smith on my schedule. If Mrs. Smith calls in and says, hey, my finger hurts, and they haven't seen anybody in any of our practices, really the question we want to ask Mrs. Smith is, hey, when are you available to come in? What office, whether you want to go to the Spectrum campus, to the Omni campus on Frank or Belpar, do you want to go to Dover? Do you want to go to Alliance? So, geography plays a factor. For some people, maybe they can't get a ride from Dover all the way up to the Canton offices, or vice versa. Do you need to see a specialist, or do you need to see a generalist? Obviously, as a specialist, I always sit a little biased in my answer to that question. I just believe if you have an electrical problem, you should call the electrician, not the general contractor. If you have a plumbing problem, call the plumber, not the general contractor. And I'm just of the same belief. I think if you have a hand problem, you should see, there's 4 of us at OrthoUnited that do hand surgery as a specialist. A lot of us do hand surgery, but 4 of us are specialists. So is this really a specialized thing, or is this more of a general kind of problem? Availability is also an important factor. I hear quite a few times where patients go to an emergency room, little Johnny broke his wrist, and they're referred to a various center, and those orthopedic surgeons can't get the patient in for a week or 2. Well, I think if little Johnny just got hurt, we need to see little Johnny today or tomorrow for 2 reasons. Number 1, to help little Johnny, but number 2, help put the parent's mind at ease and getting the point of care and moving in the right direction. Obviously, quality is important for every patient, and quality also, I believe, comes with comfort. If you're comfortable with your surgeon or your doctor, that is very, very important. If you're not comfortable with that relationship, then I would also tell people, find the person that you're comfortable with as well. And I think in today's world, the last topic is, I believe, the hottest topic, and that's the issue of cost. We all live under different financial pressures, right? Cost of living has gone up tremendously. We all battle the issues of inflation, and healthcare is on an incredible rise of cost. It is not cheap. And as a result, people are having higher deductible insurances, or if they're on Medicare, which a lot of your listeners are, they still have to pay a portion of their bill. So if you can get the same quality of care or better care and do it at a cheaper cost, that's absolutely the way to go. And I only bring that example up is because, if you hurt your finger, but it's not pointing in the wrong direction, or you don't have a big open wound, I try to tell people, don't run to the emergency rooms. And if it's something that we can handle it at our urgent express clinics at OrthoUnited, it's a regular office visit. It's not an emergency room visit. There's not radiology fees. There's not facility fees. And you're still going to get the same orthopedic care and a much cheaper cost. And I think today's world, people need to pay attention to that. I think people, unfortunately, because they just don't know, and I'm not blaming them for lack of education. It's just they've never had the experience. Maybe it's the first time that they've cut themselves or fell down the steps and they have a swollen ankle, and they're not really sure what to do, but their panicked neighbor, the plumber, says to them, "Oh my God, it's the worst thing I've ever seen." Well, and they convince them to call an ambulance and go to an emergency room. And so I think in today's world, I mean, that's why at OrthoUnited, that's why we have express clinics. That's why we have surgery centers. It's not everybody can go to these places because of potentially their injury or their other medical problems. But ideally, those are the places that we want to get people to go to and try to stay out of the larger healthcare institutions whereby, yes, if you have a lot of medical problems, you have really bad cardiac disease, of course, that's where we want to take care of you. And we can still do it at the hospital, but let's deliver it in a fashion that tries to be cost effective for the patient as well. And I think patients are becoming smarter, and they're asking much better questions. And the questions are not just medical questions, they're asking financial questions, and they should challenge their physicians and ask them, why should I be doing a procedure at the hospital when I can do the same exact procedure at a surgery center? And I'll pick my specialty, carpal tunnel. To do a carpal tunnel at a hospital, the cost is probably nearly 3 to 5 times the cost, depending upon where you'd go, than if you do it at a surgery center. And I think, you know, people don't understand those factors. They just kind of go wherever their doctor kind of tells them to go. And I would challenge patients that, you know, if you're having a surgery, as an example, the first question you want to ask is do you participate at a surgery center? I mean, OrthoUnited has 2 surgery centers. They work out of. They work out of OS3. They work out of Oasis. Between the 2 centers, I mean, there's 8 operating rooms, and so there's plenty of capacity in our town to keep patients out of the hospitals. Where do we want the unhealthy and the medically challenged? Of course, at a higher acuity center, it's better for the patient. But for patients that can be done simple outpatient, surgery centers are absolutely the way to go. And that's why Omni is invested in. We've been doing it since 1999 on our campus side. The Spectrum campus side has been doing it, I believe, for about 6 or 7 years now. So between the 2 groups, we have many, many years of experience in outpatient surgery. And that's just where the nation's going. The nation is not going to big collaborative hospital systems. It's smaller boutique places. And I would hope the patients would really have a better experience in the ASC settings.
Okay. Time for our first break, Doctor. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. We're talking with Dr. Ira Richterman this morning. Friends, just a reminder to stop by our pharmacy and talk to a pharmacist about our new Health Matters Drug Savings Program. We want to help you stay well and save money.
All right, Doctor, we've covered a lot of ground here this morning, and I think it's important to maybe touch on one other thing. I mean, maybe, you know, I had an experience where my wife had an injury and turned out she broke her leg. And honestly, the first thing one of her colleagues said was to come see you guys because we wouldn't be sitting in the ER for hours because it wasn't a life-threatening issue. I mean, we didn't have a compound fracture, but you know, I have to admit that your message to patients about, or listeners about, being aware of what's available in the community, I think is really important because honestly, I'm embarrassed to say on many levels that I knew about your new surgery suite that you guys are in, that you're in right now. I drove my wife there from Perry Township. I didn't realize your emergency clinic was only at Belpar. So, you know, just be aware of what is out there. And I think it might be an idea just for listeners to realize that, you know, it's good to listen to the program today and learn about being conscientious for healthcare and what's available outside of the hospital. But, you know, emergencies happen. And when you do, it's usually like a little bit of anxiety. And if you can save yourself a half an hour or a loved one half an hour of suffering, be aware of where to go. So can you cover maybe, you know, some garden variety issues of what might require an emergency room visit versus what you guys can manage at OrthoUnited?
Sure. The biggest and easiest distinction is the fact that if you're in an ambulance, it's not coming to an express clinic. And whether it's our express clinics, either on Frank and Apple Grove, which is the Spectrum campus, or on Belpar, which is on the Omni campus, But if you're in an ambulance and if you had to call an ambulance, that ambulance is going to one of our level 2 trauma centers downtown. But if you're going to get in your own car, and most injuries and problems can get in their own car, maybe not yourself driving, but hopefully you're a loved one or a neighbor is driving you. Most importantly, if you have an open wound, if you have a big, huge laceration, our centers are not really equipped to handle that type of trauma. But any closed injury, if it's a bad wrist fracture, if you hurt your ankle bad, you twisted your knee, it's those, you went to go pick up a bag of dog food and you hurt your back and you got some pain running down your buttock and leg. I mean, those are all appropriate things that do not need an emergency room setting. And I always try to tell people, if you get hurt, the first thing you need to do is count to 10. Just take a big breath. Count to 10, relax for a second. Even if something is bleeding, grab a towel, put some pressure on it. It's always the first, rule of thumb in first aid. But you really want to assess the fact that if you're calling an ambulance and if you think you need an ambulance in your own mind, then by all means, I'm not going to tell you not to do that. Clearly, we only take care of orthopedic stuff. If God forbid you have chest pain, please do not come to our express clinics. If you have chest pain or you hit your head, I mean, those are not orthopedic injuries. But if it's an extremity, shoulder to fingertips, hip to toes, or you bent over and you tweaked your back, those are very, very appropriate things to show up at the express clinics. Our express clinics are open Monday to Friday. Most of it's, there's a little bit of some different hours depending upon which campus you go to, but both campuses also are open on Saturday morning, especially with football season, right? A lot of games are played Friday night. The kids are all banged up Friday night. And, mom or dad, all right, I'm not sure if this is a bruise, if this is something broken. If you're not sure, come into one of the clinics on Saturday morning. Let us assess you. Let us get a quick x-ray. Let one of our docs or mid-level providers see you and get you going in the right direction as fast as we can.
Okay. Let's talk about hands a little more since you're the specialist expert. We all as human nature have a tendency to put things off. What would you consider a hand issue to be when it's an old problem or a new problem, or maybe it's getting worse? How can you maybe share with listeners today that there is a point of no return where you're probably doing yourself more harm than good by not having it addressed?
If I can give people a very, very simplistic kind of split algorithm, and in your own mind, if something occurred as a traumatic event, I fell down the steps, I landed on my wrist, I landed on my finger, I hit my finger with a hammer, I cut it with a knife. If you've had a traumatic event, those are things that we absolutely want to see sooner than later. The reason being is that I hear so many times, unfortunately, that a child, if you have a 12-year-old, right, playing football and they hurt their finger and it's fat and swollen, and mom and dad may be a little bit more concerned about the next game or the kid playing the next game, and well, if they see a doctor, may not be able to play and they maybe get pulled out for the rest of the season. However, I unfortunately see the flip side of that, and the flip side of that is the individuals whom don't come in for 3 or 4 weeks after a traumatic event. And if they had a fracture, typically the fracture is basically in a finger is almost already healed by that point. And you take a very, very simple problem that may have a simple solution and make it a very complex issue that has a poorer outcome. So Brad, if I could basically break it down into 2 simple categories. If it's a traumatic event, I fell or I swung a tennis racket and wow, I felt a pop in my wrist or my elbow, we should see you this week. If it's, I've been having some numbness and tingling in my fingers, I haven't been able to sleep the last 2 months or 4 months. Those are things that, it doesn't have to come in tomorrow. I would still call, make that appointment. But you know what? If next week or 2 weeks from now is okay, or my knee hurts, it's been sore. I played the whole season of tennis, but it's just getting a little sore because I may be 60 years old and I'm starting to get some arthritic changes They don't need to be seen at 2 o'clock today. So if I can make the most simplistic division, did you get hurt at an acute event, a one-time event, or did something just creep up on you over time? So yes, we would love to see stuff sooner than later. It really makes conversations much easier, treatment much easier, outcomes much better. And really from a cost perspective, sometimes simple things that you catch early, for example, we'll use a little splint to get by, where if it's a late problem, then sometimes it ends up as a surgical entity, which is just a much more difficult, complex issue.
Wow. As pharmacists, we hear every day, well, this hurts and that hurts. And what should I do? Should I go to the emergency room? And we still hear a lot. Well, I got to go to the emergency room. No, you don't got to. You don't got to go to the
Absolutely,
emergency.
Paul.
You don't got to go to the emergency room. I know where you can go to get checked out quickly. So
It's funny. My wife is a pharmacist as well. And as of course, not only the fact that she's my wife, but as a pharmacist, she also has me on speed dial when that patient is standing in front of her and says to her, hey, Kimberly, what do I need to do with this? And she'll say, give me a minute. And she shoots me a quick text. And that's my quick consultation, to be the orthopedic behind the pharmacist. But you're exactly correct. She tells me every evening a plethora of questions that she gets asked all the time. And it's hard as the pharmacist, just because the fact that, it's not like you can come across that window and examine the patient, or you don't have the x-ray available, or, you don't have all the tests in front of you. And it makes it very difficult in your position to answer that question.
Okay, doctor, it's bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Center Pharmacy, I'm your host and pharmacist, Paul White. This morning, we're talking with Dr. Ira Richterman from OrthoUnited. And how do patients choose between seeing a specialist versus a generalist? Is one more accessible or preferred than the other?
Paul, it's an interesting question in regards to depending upon what the individual's problem is and what the patient's desire to have or see. In today's world of orthopedics, orthopedics has changed a lot in the last probably 20 or 25 years. And almost all of the new residents who are graduating are going on to do a fellowship training in some subspecialty fashion. It's the less common individuals who are coming out and becoming a general practitioner, and just because of the fact that everything has become so specialized. If you look at the world of pharmacy, for example, even now the pharmacists are coming out of their educations with doctorates. Some of them are going on to do residencies. Some of them want to specialize in oncology pharmacy and things like that. And so I think with every world of healthcare, specialty is definitely where the trend is heading to. I firmly believe that if you look at the body within orthopedics, it's very easily, I'll use the expression, broken down into various parts that docs just like to practice in certain areas, or that's just where their fellowship training is and they've gotten extra training within it. Hand surgery really comprises elbow to fingertips. Sports medicine is kind of really that shoulder and knee world. Sometimes, the a little bit of the ankle world. The foot and ankle guys, are clearly almost knees down, and most of them are doing ankles to toes. Obviously, spine is limited to the spine. You have total joint surgeons that their love and desire is hip and knee replacements. When we look at emergency care and fractures, that's kind of a little bit of where we all become the jack of all trades, in the fact that we all cover call and emergency rooms at some point in our careers. And when I was taking call as a hand surgeon, if I was on call and I was fixing, grandma's hip, I would introduce myself as a hand surgeon, but I was always, kind of tease and be light with the patients and say, don't worry your hip, it's just a big finger. And so, but I think if you're talking elective care, I'm just a big believer in specialty. I'm just a big believer in it. If you have a hand problem, you see the hand specialists. If it's a sports injury, if it's a total joint issue, if it's a spine issue, I just think that's where your efficiency of care really just takes place. Again, I sit a little biased because I'm a specialist. A generalist would create a little bit of argument in the other direction, that they would much rather kind of see a little bit of, a dab of everything. And then the high stuff, high acuity stuff that's just not in their wheelhouse, they kick out to their partners who are the subspecialists. And there's nothing wrong with that as well. I think as a patient, you want to do what's the most comfortable for you. And I think that's really the most important thing. You got to make the patient happy. And so if a patient is calling in, I personally would rather see them see a specialist within that appropriate body part area. And that's basically where the trend of OrthoUnited has really driven our practices.
The number of physicians coming out is decreasing that are multi-talented or is that true?
I think people are becoming more niche oriented. In orthopedic world, I don't know the exact percentages off the top of my head, but when we're interviewing residents that are coming out of training, the majority of them are going on to do fellowship training. I think in medicine in general, there is a stronger push towards the fact that they want 50% of medical school classes to be primary care or family practitioners. However, they tried that for a long period of time, but I think with the rise of the mid-level care practitioners, I'm not so sure those numbers are still going to be the same. I'm not trying to pick on the radiologists of the world. My brother is a neuroradiologist, but I think when you talk about the world of AI, I think it's going to replace radiologists very quickly, because it's to some extent image recognition. And it's going to be really interesting to see where AI takes place in healthcare. I'm not a favor of that. I'm in favor of the human factor. However, I just see where the trends are going. But I think everything is going specialized, Paul. I just think that's just whether you're coming out and you're choosing cardiology as a career, whether you're choosing to become an invasive cardiologist or a non-invasive cardiologist. I think everybody, has their ways to do stuff. And it's no different than being a baker. Some specialize in pies, some specialize in cookies, and they become very good at it. And I think that's the key.
So can you explain the level of quality and how the cost applies to having hand procedures or surgeries done?
Yeah, without a doubt. If you're at a point where you need a surgical procedure to be performed, you, as the patient, first and foremost, you want to find out where you potentially going to have this procedure performed. Is that surgeon only going to a hospital? Do they option to go to an ambulatory surgery center, whether it's Oasis or OS3 for OrthoUnited? I think that's very, very important, because the cost is based off the contracts that the facility has with the insurance company. And that's a big thing that patients don't understand. When our financial counselors speak with the patients, then sometimes they get upset. The contract that we have is not with the individual patient. We have to follow the contract, whether it's Medicare, a Medicare Advantage plan. I mean, those are all designated out by the federal government. And those plans that once Medicare puts out the plan, all the other insurance companies fall into line with some percentage of those plans. Now, if you're a very, very large institution, and you have some leverage and power, you can clearly get those commercial payers to pay more. Not to pick on people in our community or big players, but that's what happens. And so as a result, if you go to an ambulatory surgery center, the contracts are easily a third to a fifth of what for the same exact procedure to be done in a hospital setting. The other thing that people don't understand is when we say quality of care, everybody just thinks about the surgeon themselves, but it's more than that. And I try to use the analogy of the operating room, which I'm in one right now at Oasis. But the operating room, you have a team. The surgeon is just one component of that team. You have an anesthesiologist, a CRNA, you have your surgical assistants, you have your scrub techs, there's an OR nurse in the room with you, and any other assistants, PAs that you may have. And when you operate, if you're the surgeon, that's analogous to the quarterback on a football team. And if I said to you, Paul, this weekend you're playing for the Cleveland Browns, but I got news for you. Every 4 sets of down, you're getting 5 different offensive linemen in front of you. It's probably not going to go so well for you that game because you're not necessarily used to everybody. And that's what happens in hospital settings. Every time a surgeon goes to operate at the hospital, they're usually placed with a different team. And in today's world, with everybody's familiar with locum tenens, I may go down to the hospital and the person who's with me may be there for 3 months, but they're coming from Texas to fill a slot. At our surgery centers, our staff has been with us for a very long period of time. I've been operating with the same people at our surgery center for 10, 15, and 20 years. We know each other. We've done it well together. I've worked with the same anesthesia group since I've been into town. And I think those are really, really important factors to consider to say, where is that surgeon the most comfortable? Because wherever that surgeon is the most comfortable, wherever his or her team is the most comfortable, that's where I want to take my patients. And I think that's very important for people to understand. Surgery centers are no different of a business than a hospital is a business, except the contracts that we have with the insurance companies are at a fraction of a cost. And I don't understand in today's national world, if you need a surgery and with appropriate medical reasons that surgery could be done at a surgery center, that surgery should be done at a surgery center. It's an overall cost. It becomes savings to our community, to the patients, at the national level with Medicare, right? All of your listeners here, how Medicare is going to struggle as us baby boomers are, all approaching that Medicare age. I think that we have to be sensitive to that fact, and the patients, I believe, are the ones that should be driving the delivery of healthcare. Unfortunately, I think we have the tail wagging the dog a little bit. I think it's Medicare. I think it's our federal government that's driving this. And I think the patients need to drive it. And I think whether, as you mentioned all the time, Paul, you and Brad mentioned, you talk about cost and pharmacy. I think that's incredibly important. Medications are very expensive. If you can get the same medication at your facility at a cheaper price than another facility, why would that individual ever go to another facility? It doesn't make any sense to me. And healthcare and surgery is the same way. Let's get patients to surgery centers. Let's keep them out of hospitals. Let's get them home. When I started orthopedics in 1991, if you had a hip replacement, you were in the hospital for 10 days. Now you're lucky if you're at the surgery center for 5 hours.
Jeez.
It's unbelievable. My father-in-law had his knee replaced last summer. And so I got to personally witness a knee replacement with an outpatient. Dr. Pence performed his knee replacement. And it occurred at 7 a.m. on a Friday. He was home at noon and he was sitting at the dinner table with us at 5 p.m. And it has changed dramatically. And you have to have your family to be engaged with you to do that. It's hard if you're living by yourself, but if you have some support, it's absolutely the better way to go.
Okay, doctor, our final break is here. You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. You're listening to our final segment with Dr. Ira Richterman. So, doctor, some people just like to wait it out and hope the pain and issue will go away. I'm sort of that kind of a person. When does time and delay of seeking medical care affect the outcome?
There's a couple factors that are involved. Let's talk about a factor such as numbness and tingling in the fingers. There's various causes of numbness and tingling in the fingers, whether it's the more common entities such as carpal tunnel syndrome, what's called cubital tunnel syndrome, a problem with your ulnar nerve, whether it's a spinal issue at your neck level. But numbness and tingling is not a normal phenomenon. And if you have numbness and tingling in your fingers and a week goes by, 2 weeks goes by, 3 weeks goes by, and it hasn't changed, I think it's important to mention that to your primary care physician, your family physician, call us in the office, and at least get us evaluated. Sometimes the answer is, let's not worry about it. Let's just watch it for a little while. But the difficult problem is that everybody goes to Dr. Google and Dr. Facebook, and I encourage them to become as educated as they possibly can. I am a big believer in education, and I want people to get educated. The hard part is, as the layperson goes to Dr. Google and Dr. Facebook, oftentimes their diagnosis is wrong, and so they come up with all these various treatment options and things to do, like wait, do nothing. But unfortunately, their diagnosis is wrong. And if we would have seen them a little bit sooner before they have permanent damage or permanent change, I think that's really a factor. I think more importantly, most physicians would say, you know, when in doubt, pick up the phone and call us and let us do the evaluation, and let us be the one to tell you, hey, you know what, this is something we don't have to worry about. Or, hey, you know, you got some arthritic fingers here. They're not really bothering you too badly. Or I may say the opposite. I saw a gentleman about 6 or 8 weeks ago who came in with a little bump on the back of his hand. And unfortunately, I said to him, I said, you know, this is a malignant cancerous lesion. This needs to be removed. And because he thought he was just going to find something, you know, over the counter and topical to put on it, because in his own mind, he thought it was a wart. And so, you know, I think the right answer is when in doubt, be informed, get the right education. You know, when I see patients in the office, a lot of times they all want to come in and tell me what their research was and tell me what they found and what their diagnosis is. And I try to say, you know, with a little bit of you know, happiness, so to speak, that, hey, I say, hey, you know, you're paying me for my opinion. You're not paying me for me to hear your opinion. And I believe that a lot of times patients come in and they're so worried about asking a question and figuring out what they need to do for work, that more importantly, when you go see your physicians, the most important thing that you need to do is tell them the story of why you're there. How something happen? How long has it been there? When did it start? What makes it worse? What makes it better? I mean, that giving that history is incredibly valuable. Then the next component is let your physician, let the mid-level provider examine you. And then finally, I say, listen to the explanation. Let them explain to you what they think is going on with the diagnosis, and then what treatment plans are and options are. And then it's at that point, take your list of questions and let's go through the questions. But too many times patients come in and they're so worried about asking the question that they don't want to listen to any other components of the exam. You know, I think somebody asked me one time, for example, you know, what's my favorite surgery to perform? Well, I don't think I really have a favorite surgery. What I like is I like educating you and let me teaching you about what the problem is. Whether we operate on you, whether we do therapy on you, whether I provide you a prescription for medication, that's a joint discussion that a physician has to have with the patient. That's not a one-way street. Now, sometimes patients will come in and you say, you know, when is something need to be seen sooner than later? You know, I always say, if something's bothering you, come see us. The hard part is you're exactly correct. It's very difficult because there's a plethora of different problems. And I don't want everybody with every little lump and bump on their hand to worry about that they have cancer on their hand. Certainly that's not the point of this discussion. But if you have something and you're not really sure about it, show a healthcare provider, let them see it. If that individual isn't sure about it, let them send you to somebody else or a specialist. And maybe most of the time the answer is, it's a simple little bump. It's a simple little cyst. If it's not bothering you, don't bother it. And I think that is the most important thing. It's you got to get that education behind you to figure out what's really going on. It's making the right diagnosis.
Wow.
You know, thinking about everything you just said, I think a component of that too on the patient side is fear. You don't want to hear you need surgery. You don't want to hear you have a problem. So you already mentioned a fascinating example to us earlier about how quick a possible knee replacement turnaround could be. Can you just touch on briefly, like a hand surgery, like a carpal tunnel? I think most people have heard of carpal tunnel. Most people are afraid of surgery and how long they might be out of work, or they can't pick up their grandkid, what's a garden variety hand surgery recovery time?
So if you're using something like, let's take the most common ones, Brad, whether it's carpal tunnel, it's a trigger finger, taking a little lump and bump off the hand. My personal routine so to do a carpal tunnel, for example, takes about 5 minutes to do. The actual OR time is about 5 minutes. It is not a long procedure. And typically the way I do them, I always tease the patients. I say we schnooker them. For all of your listeners who have had a colonoscopy, you got schnookered. And so that's what schnookering is. It's sedation. People will use the word twilight. And we do that. It takes about 5 minutes to do. We make their hand numb. We do the procedure. They have a small little wrap on their hand. But my protocol afterwards is I'm a big believer in keep it simple, because simple things work. I use the dumb expression. If it hurts, don't do it. If it doesn't hurt, go ahead. Now, granted, I don't want you to take your hand and go put it in on the farm in the pig poop, right? That's not the right thing to do either. But keep it clean and dry. But in hands, the most pivotal thing in hands, and all my hand therapists I know are listening to this talk right now because they're all texting me at this time. And I'll tell you that they will all tell you the same thing. You have got to keep your fingers going. Now, certain injuries like fractures, I can't let you move until the fractures heal, which typically for finger fractures take about 3 or 4 weeks. But for the average, most hand surgery, it's go. Yes, you may not grab a jackhammer tomorrow, but for most things, I want people to use it, go and do. And again, my personal routine for after my surgeries, I like the patients to keep their bandages clean and dry just until your stitches are out, which is about 10 days later. And so I ask you when you hop in the shower, put a little glove on, little bag on. I just am a believer, if it gets wet, it just increases the infection rate a little bit. So I'm really a risk manager. I want to minimize the risk to the patient. And so if they stay on the dry side, yes, it's a little bit more of a nuisance to put a bag on when you hop in that shower. I just think all the wounds just do better. But typically for most hand surgery, now Brad, that's totally different than the severe traumas that we see. The unfortunate person who puts their hand in the lawnmower, or the snowblower, or the log splitter, the chainsaw. I mean, we see it all the time. In those individuals, clearly it's a much more complex problem that needs much longer convalescence of care. And some of those problems, for example, if you cut a tendon in your hand on the palmar side, you may not be able to kind of get that hand going for almost 12 weeks. It's a long recovery. But the flip side of that is if you cut your hand on the palmar side and you cut your tendon, you ideally only have about 7 days to fix it, because then you can't get it repaired after that point. And that's where, Paul, you brought up that issue. When is essence really an issue of essence? And certainly trauma, get in this week. If it's non-traumatic, you have a little bit more time.
All right, doctor, we're out of time. Any final words?
I appreciate you guys having us on. I can't tell you how many patients I have that listen to your program and they come into my office and say, hey, I heard you talk last week on WHBC on your guys' program. So you guys have been doing this a long time. It's very much appreciative to our community, and please keep Health Matters going.
Okay, wonderful. Thank you very much, Dr. Ira. And with OrthoUnited, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday. This is our 13th year, by the way, on News Talk 1480 WHBC. Thank you, Doctor. Very good show.
Thank you. Appreciate it.
Very good.
Thanks, doctor. Have a great day.
Yep. Take
Thanks,
care.
guys.